Great. Hopefully everybody can hear us. So thanks so much, Donna, for the introduction. This is Sarah and Cindy here. Before we begin, we want to recognize that we're speaking from the unceded territories of the Musqueam, Tsleil-Waututh, and Squamish peoples today, where we're speaking from. And we want to go about this work with the intention of being good guests here in these coastal territories, and also want to recognize the various territories from which you're all joining us today.
This is Cindy. We're really delighted and honored to be talking about approaches to reframe family violence with everyone who's joining us for the webinar today. We look forward to hearing from Leanne Simpson, whose words will provide the main substance of the webinar, as well as to hearing from those of you who have joined us as participants. As the overview says, Sarah and I are going to start the webinar with an introduction to our approach to this topic of family violence in Indigenous communities. This work will touch on some of the work that we've been doing for a paper for the National Collaborating Centre on Aboriginal Health. Leanne will then center Anishinaabe stories and her thoughts on family violence within the teachings and Anishinaabe practices of kinship. These teachings will provide a foundation for rethinking family violence within a decolonial lens and foster a reimagining of these issues with Indigenous voices and experiences at the center. Sarah and I will then close the webinar with some discussion questions and ideas for future reading. Before we get into the material, we just each want to take a moment to introduce ourselves.
Gila Kasla, I'm Sarah Hunt. I'm a researcher and writer of Kwagilth ancestry from the Kwakwaka'wakw people from Sahis, or what's known as Fort Rupert today. And I'm also of English and Ukrainian heritage on my mom's side and grew up in the Kwungan territories, or what's known as Victoria, BC. I'm an assistant professor in First Nations and Indigenous Studies, as well as the Department of Geography at UBC, and currently also hold a postdoc with the National Collaborating Centre as well. And my approach to these issues of violence emerges from my years of working at the community level with youth and families, primarily around BC, both within government-created policies and programs, as well as fostering community responses that are rooted in Indigenous cultural teachings and practices. And I'm really delighted to be part of the conversation today. So thanks, everyone, for joining.
Hi there, I'm Cindy Holmes, and I'm a white queer settler of Scottish, Irish, and English heritage who grew up on the traditional territory of Yadawandran people in what's known now as Guelph, Ontario. I am now a visitor on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people in the city known as Vancouver. I'm a researcher and an educator. I have a particular interest in connections between violence, gender, sexuality, colonialism, and health. And this grows out of over 20 years of community-based work that I've done in anti-violence, health, and social justice movements. And most of my work has focused on violence in the lives of women, Indigenous people, and lesbian, gay, bisexual, queer, transgender, and two-spirit people. I'm currently a postdoctoral fellow with the National Collaborating Centre for Aboriginal Health, and I'm also a Michael Smith Foundation for Health Research postdoctoral fellow at Simon Fraser University, where I'm coordinating participatory action research project with two-spirit, trans, and gender nonconforming people about safety, belonging, and well-being. And I'm very pleased today to be joining Sarah and Leanne in this conversation.
We want to begin by talking about the importance of family and kinship to Indigenous peoples and communities. Family and kinship structures have always been at the heart of Indigenous communities' wellness and ability to function as self-determining peoples. Of course, the way that knowledge is passed on within families and the way that kinship itself is understood is culturally specific and unique to each Indigenous people. But generally speaking, we know that historically and in some communities and to different extents today, extended family lineages form the core of Indigenous peoples' identities expressed across the generations in culturally specific ways. For Indigenous peoples, family relationships are enacted within a network of reciprocal responsibilities between Indigenous peoples and their non-human or animal kin, the land and waters, and the supernatural, spiritual, or ancestral realms that comprise their territories. And of course, we know that a key strategy of colonialism was to attack these family structures. So this occurred through the imposition of patriarchal nuclear family models in the Indian Act, through the residential school system, and through the imposition of inequitable gender roles rooted in the patriarchal binary. So we can see a cultural gap between how Indigenous concepts of family differ greatly from the nuclear family models that have been imposed through colonization. As we see in this quote from Professor Jessica Ball, who is at UVic School of Child and Youth Care, Euro-Western models of the nuclear family, in which one father figure, along with a mother figure, is intended to meet all of the child's needs for guidance, discipline, affect, and support, have never characterized traditional Indigenous communities. So when we talk about Indigenous concepts of family, it's important to recognize that Indigenous cultures were and are dependent on the healthy, functional relationships that operated within extended family structures, and that Indigenous peoples have always had ways of ensuring the maintenance of strong kinship networks as part of their survival and self-determination.
Indigenous knowledge systems around the world embrace a holistic and interconnected understanding of health and well-being, which is in stark contrast to Western Eurocentric and colonial constructs of health, which imagine body, mind, and spirit as disconnected from one another and from other social, cultural, spiritual, and environmental factors. And the social determinants of health are usually understood to be the social and economic conditions that influence the health of individuals and communities. And violence and colonialism are recognized as social determinants of health. However, in much of that literature, in the social determinants of health literature, we see that colonialism is frequently not seen as an overarching determinant of health in Indigenous people's lives, but rather as an add-on to other social determinants. Many Indigenous people have emphasized the importance of moving beyond the social in understanding the determinants of health, including Margot Greenwood, the director of the National Collaborating Center, Sarah DeLeo, Nicole Marie Lindsay, and Charlotte Redding in their recent book, Determinants of Indigenous Peoples' Health in Canada, Beyond the Social. The authors emphasize that an approach that goes beyond the social recognizes first that colonialism is the most fundamental determinant of health for Indigenous people in white settler colonial states and is an active and ongoing force influencing the well-being of Indigenous peoples in Canada. Secondly, that Indigenous knowledges and ways of life must be the primary frame of reference for understanding Indigenous health. Third, that Indigenous voices and authors must be centered. And finally, that moving beyond what is typically understood as the social may include an understanding of geographic, including land, economic, historical, spiritual, narrative, genealogical, language, structural determinants of health, as well as gender, culture, age, etc.
So moving to a discussion of the legacy of work to address violence within Indigenous families, homes, and intimate relationships, we begin by recognizing that as long as there has been violence, there has been resistance. Beyond the diverse programs, research, books, or other formalized anti-violence efforts that show up in the literature, it's important to recognize that much of the resistance to violence has taken place out of view precisely because it's taking place in our homes, families, and intimate relationships. So rather than just focusing on histories of violence, we also seek to hold up the everyday resistances of our relations who have been working to create change. We found that a discourse about what has come to be termed family violence in Indigenous communities first emerged in Canada in the mid to late 1980s. Most of these early efforts were led by Indigenous groups, primarily with women taking the lead. Discussions of family violence emerged alongside broad efforts to name various forms of violence as violence, to name sexual, physical, emotional, and other forms of abuse, along with the systemic and historical factors which were at the root of that violence. Many initiatives to name family violence came from survivors who were themselves living the daily impacts of abuse, and many of these survivors sought to break the cycles of intergenerational violence in their own homes by being an agent of change. So naming the violence, just that act of naming, was for many a first step. Naming the legacy of residential schools was also key to understanding patterns of abuse, both because of the physical and sexual violence students endured, and also because, as we talked about before, of the family disconnection that the systems created. And it's important to remember that at this time that the discourse first emerged in the 80s, residential schools were still operational, as the last school here in BC closed in the 80s, and the last one in Canada closed in 1996. So part of grappling with the legacy of residential schools was and is understanding that survivors brought new patterns into their own homes and families. At the community level, efforts to name and address violence within families has been connected to broader efforts to end the various forms of violence experienced by Indigenous women and girls especially. We also see that the anti-violence organizing of gay, lesbian, bisexual, transgender, and two-spirit Indigenous people is vitally important, yet it often receives less recognition within this field. So two-spirit people have been deeply impacted by their marginalization or erasure in the Indian Act, as well as by homophobic, transphobic, and sexist violence, and that includes violence at the hands of their own family members, something we understand as being under the rubric then of family violence.
The late Patricia Montour Angus is one of many Indigenous women who have called for expansive definitions of violence that reflect the complexities of colonial power relations and the intersecting and interrelated forms of violences experienced by Indigenous peoples. Speaking from her experiences as a Mohawk woman, she identified racism, colonialism, and state violence as inseparable from other experiences of violence in the lives of Indigenous women. She explained that, quote, violence is not just a mere incident in the lives of Aboriginal women. Violence does not just span a given number of years. It is our lives and it is in our histories. She goes on to emphasize that organizing against a single form of violence, men's, is not a luxury that I have experienced. The general definition of violence against women is too narrow to capture all of the experiences of violence that Aboriginal women face. Here we can see the need to not only understand the continuum of violence experienced under colonialism, but to develop definitions of violence which account for more than just individual acts of gendered violence. Patricia Montour Angus was speaking out about the problematic and narrow definitions of violence that she saw in white feminist anti-violence organizing. Organizing against violence against women and within families grew out of grassroots feminist activism in the 1960s and 70s when women established rape crisis centers, shelters, and transition houses. And then government funding, programs, and legal reform efforts followed in the 80s and 90s. The discourse on violence against women and family violence in these services and programs tends to represent the violence in certain ways and with certain underlying assumptions. That families are heterosexual and nuclear, two people, male, female, who may be co-parents of children, and that the violence is male violence against women. And in that, gender, not race, class, sexual orientation, or other factors, gender is seen as the nucleus of power dynamics. In this framework, the methods of addressing violence against women are offering services for survivors, advocacy, trauma counseling, criminal justice system supports, providing transitional housing and related services for women leaving abusive partners, improved responses from the justice system, including protecting witnesses, protecting children, and offering or mandating counseling for male offenders. Indigenous women, along with feminists of color, low-income women, poor women, and lesbian, gay, bi, trans, queer, and two-spirit people, have argued that the established anti-violence frameworks that have dominated the feminist anti-violence movement have focused too narrowly on gender-based interpersonal violence in the private sphere of the heterosexual home and have lacked an analysis of the interlocking nature of gender, race, sexuality, class, and disability, thereby ignoring multiple forms and contexts of violence. So we want to simply highlight this context for understanding how certain ideas and responses have become normative in how we understand the issue.
We're currently in the process of conducting a review of the Indigenous family violence, intimate partner violence, or relationship violence literature from 2000 to 2015. There's a great deal of important work that's been done over these 15 years, including making visible some of the innovative community work that's been going on. But we also began to recognize some troubling trends in how the discourse of family violence has been working to reproduce some ideas about Indigenous people, our families and communities that emerge out of colonial relationships. So that is, we've begun to identify ways in which the framings of family violence often fail to reflect Indigenous people's lived understandings of both family and of violence that we talked about earlier. So we just want to touch on a few of these trends today. The first trend is that colonialism is being acknowledged as a problem of the past. While some of the literature talks about residential schools or other colonial impositions within Indigenous family systems, it's often framed as though colonialism is over. And this is counter to how we understand colonization as a key factor in Indigenous people's health today, especially as we live and work here on unceded territories. We also see that the main factors being named at the root of family violence are drug and alcohol use and poverty. But rather than looking at how poverty and substance use are fostered through legacies of trauma, inequitable systems, racist education, which leads to less job opportunities, and so on, the analysis often serves to naturalize these qualities as being somehow a native problem. Effectively, these patterns are not examined alongside systemic harms, but instead used to label Native people as inherently addictive, criminalized, or poor. And this then leads to the next troubling trend we've been seeing, which is that discourses of family violence often portray Indigenous peoples through a lens of pathology or criminality. Patterns of violence are portrayed as being somehow inherent to Indigenous peoples as one of many types of crime running rampant in our communities. And finally, we found that none of the sources we surveyed over these 15 years contained any reference to gay, lesbian, bisexual, and two-spirit people. So two-spirit people are being further erased from discussions about our families, our kinship networks, and intimate relationships. We did, however, find limited discussion of Indigenous experience in some of the literature on gay, lesbian, bisexual, intimate partner violence.
So just following from what Sarah's talked about there, we see a number of underlying assumptions in these frameworks. Violence is predominantly defined at the interpersonal level with a focus on physical, emotional, sexual violence between two people. And the majority of the sources that we've looked at mirror mainstream domestic violence discourse in portraying men as offenders and women as victims of abuse. Some literature states that while anyone can be a victim or perpetrator, with the exception of young children, some Indigenous family violence intervention programs have emphasized that they have focused their definition on men perpetrating violence against women and children because it is the most prevalent form of abuse. Similarly, some research has emphasized the fundamental importance of ensuring that all solutions should prioritize the safety of women and children who have been abused. While much of the literature names contexts of shame, fear, silence, and also what might be called hiding family violence, most of this doesn't really address the context of ongoing racialized state interventions and the pervasive racist and sexist stereotypes about Indigenous people that actually work to produce this silence and shame. Similarly, we've noted that some literature draws on a psychology discourse that works to pathologize Indigenous communities through the naturalization of the violence, as Sarah discussed earlier. For example, describing the violence as, quote, a trait or, quote, characteristic of Indigenous communities rather than something that's being actively produced through ongoing systemic colonial state violence. In some cases, systemic and structural factors are named in the literature as factors, but are not themselves defined as forms of violence. So the continuum of violence that Indigenous people experience in their lifetime and in their family's history is not well reflected, such as land theft, residential schools, child welfare, foster care, racist police violence, etc. A crime control discourse pervades much of the literature, and here we see family violence defined as a crime perpetrated by individual Indigenous people. As well, the Canadian criminal justice system is centered in much of the literature as the framework through which to understand and respond to the violence. In this, individual assaults and patterns of individual behavior become the focus, and intimate relationships then are really privatized and positioned as outside of the wider social and spatial contexts. So we're really interested in highlighting what is rendered invisible or pushed out of view when these frameworks are being centered. So recognizing that settler colonialism is ongoing, that it is not something of the past, that state policies and practices aimed at addressing family breakdown are themselves forms of violence. For example, residential schools, the 60s scoop of Indigenous children from their families, child welfare practices today that remove Indigenous children from their families and communities, that these are forms of violence. Indigenous families do not necessarily adhere to nuclear family models, that the justice system is another conduit of racist violence that criminalizes victims, disproportionately convicting and incarcerating Indigenous people, which all contributes to a continuing cycle of violence. Also, we miss seeing that rural and reserve communities have very minimal programs and services. And then gendered violence goes beyond heterosexual relationships. As we've mentioned already, two-spirit and trans people face family violence in the form of homophobia and transphobia and abuse within the home, as well as intimate relationship violence. And many of the programs and services that are developed do not account for Indigenous, LGBTQ, and Two-Spirit people at all. Just want to mention that the poster on this slide is from the Native Youth Sexual Health Network, from their Native Youth Photography Project, and they encourage people to download these posters and use them and share them in your communities.
So within the increasing and constantly growing and evolving discussions around violence then in Indigenous communities, there's a push to challenge these narratives. There is a sense, certainly within many communities we've worked with and in our own work, to foster the resurgence of Indigenous cultural and legal practices, as well as to foster healthy gender and sexual relations that the dominant family violence frameworks don't fit. The bottom line is that the violence hasn't stopped. That violence of all kinds continues to be a daily reality for Indigenous people, including among intimate partners and in our extended family networks. In a 2010 special issue of Pimatissiwin, which I'm mispronouncing, sorry about that, a journal of Aboriginal and Indigenous community health focused on domestic and lateral violence, Dr. Nancy Gibson writes that despite the fact that a discourse around Aboriginal family violence has existed for 30 years in Canada, the words and concepts around violence in the family are still unspoken in many Aboriginal communities and also in the literature. So clearly, many of the solutions aren't getting at the kinds of change we want to see. As Cindy Baskin noted in her 2006 book chapter, Systemic Oppression, Violence and Healing in Aboriginal Families and Communities, Indigenous scholars, communities, and practitioners have identified the importance of developing understandings and responses to violence which connect with current struggles for self-determination at personal and community scales. And this means that centering Indigenous people's voices, agency, and self-determination in anti-violence efforts are key in order to avoid reproducing colonial power relations. Further, stopping the violence means stopping all forms of violence, a continuum of violence, including those perpetrated by state actors and systems. Anti-violence efforts are further complicated by the constant need to push back against portrayals of family violence in the media, and in some research by various government departments and scholars, that violence is somehow innate to indigeneity, as we've been talking about. For example, we've seen this in some of the recent coverage of missing and murdered girls and women, as the source of the violence is located within their own families. And of course, we're not denying that there are offenders within Indigenous communities, certainly not, but only that there are plenty of other factors that we've been talking about that cannot be ignored. Further, there are widespread calls to address people and relationships, as we've been saying, that don't fall within heterosexual nuclear families. And this includes looking at violence in extended family networks, including the ways that patriarchal forms of power are wielded by some leaders through violence in traditional kinship systems, and bringing visibility to the violence Two-Spirit face in their homes, including homophobic and transphobic violence and intimate partner abuse, as we've been discussing. In reframing the issue within expanded definitions of family in culturally specific terms and expanded definitions of violence to account for colonial relations, a continuum of approaches have been taken up, anti-violence measures within broader resurgence movements. At the heart of these efforts is understanding that Indigenous resurgence is simply not possible without addressing violence, which continues to break down our kinship obligations. Some approaches have sought to indigenize mainstream anti-violence programs, policies, and models, such as through developing culturally safe programming and the integration of cultural teachings into existing programs. But other approaches have created alternative models at the community level, which get at the root of cycles of violence by fostering a revitalization of Indigenous peoples' individual and collective agency, reciprocal responsibility, and accountability. Some of this work gets overlooked as being about family violence per se, but we see this being vitally important to ending cycles of abuse. And this includes some of the examples you see there on the screen: revitalizing coming-of-age ceremonies, restoring kinship networks, revitalizing conflict resolution within our own legal traditions, embracing gender roles not rooted in the patriarchal model, and land-based programming. Taken together, these approaches seek to revitalize Indigenous ways of being and relating to one another in which violence is unimaginable. Not content with simply having less incidents of violence, these approaches instead seek to think far beyond state-based solutions to see Indigenous cultural practices as key to fostering health and safety in our homes and families. Indigenous cultural teachings and practices then are rooted in laws that are vital for violence prevention. And these include teachings about healthy relationships based on reciprocity, respect, consent, and sovereignty. Each Indigenous community then has culturally specific repercussions for violating these teachings. So restoring the capacity to enact these repercussions, to effectively seek accountability in our own practices is key. Within this approach, Indigenous people's agency is recognized as essential. So instead of looking externally for help, these approaches entail looking internally to our own systems of accountability. And again, each Indigenous community has its own stories that contain teachings about how to live well with one another. So there is no one solution or one cookie cutter approach that'll work for everybody, but each Indigenous community or culture has its own paradigm for fostering the health of its kinship relations. And on a slide here, I've included a photo of 2 woven chilkat pouches that my aunties made me. For me, they symbolize the ways our kinship practices weave us into relations which extend back for generations and bring our ancestral knowledge about our relationships into the present day. And so with that, within this context, in this framework, we're very pleased now to introduce Leanne Simpson, whose work has been really central in this reimagining of family relations.